572-0383 or 572-0215. REV-UP St. Lucia, the alpha of radio.
Join Dr. Leonard Surage on REV-UP St. Lucia Tuesdays from 6 p.m. to 7 p.m. for Doctor in the House. This 1-hour discussion call-in program delves into the science of various diseases, treatments and medical processes, and offers in-depth explanations to empower listeners and help ensure a better understanding of healthcare for all. So tune in on Tuesdays from 6 p.m. to 7 p.m. for Doctor in the House with Dr. Leonard Surage, only on REV-UP St. Lucia. Doctor in the House is brought to you with the compliments of La Place Salaison, Journal Cooperative Credit Union, and Tapio Hospital.
At Tapio Hospital, caring and competent obstetric consultants will see you safely from prenatal care through delivery with a team of excellent pediatric and anesthetic support. Tapio Hospital, where the patient safety comes first.
In the heart of St. Lucia, where mountains meet the sea, there's a story of resilience, community, and a promise kept for over 50 years. Jana Credit Union has been a pillar of support and a friend. Together, we've weathered storms and celebrated triumphs, from sponsoring local events to supporting education. Our motto, together we can move mountains, isn't just words. It's a commitment to unity, progress, and shared success. Feel the pride, the belonging, and the warmth of a financial partner that cares. Join us and be part of something extraordinary.
It's delicious.
La Place Salaison is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Salaison, of course. La Place Salaison, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
It's now time for Doctor in the House, live on REV-UP St. Lucia, hosted by Dr. Leonard Surage. Dr. Surage, good evening and welcome. Nice to see you again.
Thank you, Andre. Thank you for this warm welcome, I must say.
You're welcome.
And welcome again to Doctor in the House. Today, like every Tuesday, I try to bring something special. And today I have two ladies with me, and we will be talking about an annual event, which is the 3rd of March. We are talking about the children hearing evaluation and hearing emphasizing on prevention. Essentially, every year, World Health Organization puts out a deadline, and so that on the 3rd of March, they celebrate, call it the Hearing Day, every year. So this is about the 3rd year we have been doing a program that leads on to the 3rd of March. Today I have with me two very well-known people in the hearing and pediatric circles, and that is Dr. Ogunlusi, and who is the community pediatrician. Do you cover the north and the south as well?
Yes.
Right. And Nurse Sydney, who she's a nurse practitioner, but also heading the unit, the hearing and evaluation unit at Entrepot, working very hard on that thing. And she also goes Beaufort and Soufrière as well. So, ladies, welcome. And
thank you.
And I'm happy to have you all here again for us to see what progress we can make into two main areas: to detect hearing loss in children early, and to be able to prevent it if we can. So welcome, and maybe a few opening sentences from you if you want, or if you want to go straight ahead and tell me what do you hope to achieve in this year's round of hearing evaluation and prevention.
Thank you, Dr. Surage. I'm happy to be here with you this afternoon. And like you said, today we want to sensitize the whole community about hearing and hearing care in children. Now, Sydney will be telling us more about the World Hearing Day. But suffice for me to say that the theme for this year's World Hearing Day, which is coming up in March, on March 3rd, is From Community to Classroom, Hearing Care for Every Child. So this year the focus is for children. We want everybody to be involved, from the community to the schools and the homes. We want to be involved. So the emphasis for this year is one on preventing hearing loss,
Right.
and also early detection, early diagnosis, so that treatment can be given. So today our aim is we want to sensitize the whole community, know about hearing and hearing loss, and how we can prevent hearing loss, and also, if it's there, how we can detect it, because the earlier it is detected, the better. We'll be talking more about this later.
Yeah. So you tell us a little bit about the what's going to happen for the rest.
Okay. Thank you very much. And thank you, Andre, for having us here, and Dr. Surage. As was said by Doc, this year, World Hearing Day, 2026, the theme is really looking at children moving from communities to classrooms and addressing hearing care for all children. The aim of this campaign really is to prevent avoidable childhood hearing loss, and also for early detection and care of children with hearing issues. As we are aware that the hearing plays a very important role in a child's development for language, speech development, social interactions, and learning. And I think it is very imperative that we address this issue.
Yeah, because I wanted to be as interactive as possible, so anybody can chip in it to make a contribution while we are doing it. But it is true, because I mean, statistically, about 90 million people, children, suffer from hearing loss globally. We do not have, I don't know if we have statistics for hair, St. Lucia, but globally, when WHO put out their stuff, they usually look at the global picture. And it is saddening to know that a lot of this thing is preventable.
About 60%.
60% is preventable.
And while we may not necessarily have the prevalence of the children, because again of statistics, having to gather all the information to get the statistics, because we, on average, we would have seen more than about 200 children throughout the year. Actually, last year was one of our greatest achievements, in that we were able to screen, I think, almost about nearly 500 students. Children. And sufficing to say, most of the hearing loss that we had detected was conductive loss. So it is like we rightly said, more than 60% of hearing loss, especially in children, can be prevented by early treatment of conditions and so on.
And maybe I can chip in there and tell you that the conductive hearing loss is when the hearing loss is due to the sound unable to get from the air into the brain. So this is called conductive loss, because the conduction of sound has been impeded or reduced, so they have a conductive hearing loss. And there are many things that can cause it. The simplest thing is wax.
And it's one of the commonest causes of hearing loss in children.
But what I found with wax, let us spend a little time, because it may seem like small stuff, but as children would see the parents put cotton buds in the air. And when parents are not looking, they get the cotton bud and put it in the air as well. They have damaged the air that way. I've had one particular occasion where a child had the cotton bud, stick it in the air, didn't take it out, and walking along and the dog bang on the air. Damage everything inside. So parents have to be careful the things they do in front of the children. We keep on saying you should not use cotton bud. There is a dilemma to that because some people can use it. If you have to put medication on your air around it, you can put it. But I think essentially what we are saying, do not push a cotton bud where you cannot see where it's going.
Yeah, exactly. And we find many of the cases, foreign bodies. So we find cotton buds, we find the rubber in the pencil.
Yeah.
And also the tip of the pencil in the children's eye.
So the lead.
The piece of lead in the air. Some time ago we found one of those studs. So, some of the things that we overlook, like a stud earring, and there was that part in the child's eye. So there are lots of things that we are encountering with the children.
So there is wax, there is foreign body, basically. We, in medical term, call it foreign body. And basically it is anything that's not supposed to belong to the air. But we still call wax foreign body. But anything that's not supposed to be in the air is foreign to it, and it's called a foreign body. Just for the general public to understand what we are saying.
Before we leave the issue of wax, Dr. Surage, if I remember, while in medical school, we were taught that there is this normal mechanism in the air as the cell is dividing that will push the wax forward until it is easy to remove. And there are some mothers that think, it is part of routine care. Every day they want to clean the air. And I don't think that should not be done, because once the wax is, the normal cell division will push the air, the wax forward until it is visible and can easily be brought out without poking the cotton bud inside.
So if you are an ant, a little ant, and then you are small enough and you decide to walk into the air, just to get a feel of how the inside is made. So you'll climb into the outer part of the air, get into the air canal. In the first third of the air canal, you'll see a lot of hairy bits. These hairy bits are the ones that makes the wax. It is with the hairy glands have oily glands that makes wax. But it doesn't make oil, it makes wax, which is a thicker version of oil. So if you continue, then there's a slight dip, and then you get to a wall, and that wall is the tympanic membrane, the eardrum. So you climb the eardrum from bottom to top. Usually is about half an inch long or thereabout. And then you get to the roof, and then you climb out for the roof, out you go. So it shows you the air is the outer air is made of a canal. The outer third is where the wax is formed. Now, sometimes there is an area that can cause coughing. So if you go too far, you start coughing. And they also, if the wax is in the outer third, then it should be only moving out and not go back in. So therefore, putting cotton bud can make it go out. But let me explain one thing to you, and that is the drum, which I mentioned a while ago. You climb that wall. That drum, the cells there multiply faster than adjacent. So therefore, it spreads the skin out along the edge of the drum into the canal, and so your air, the skin of your air is shed like a tube and not like flakes. And so many people see the tube, the dead skin as a little tube, and pull it out and think it's wax. It's not wax. And anything that is resting on that dead skin will come out. That's how the wax cleans itself. Yeah, so.
And it is still important for them to know that wax is essential, like Doc said, to trap those little insects. It is important.
Trap insects, traps dust, but some people make more wax than others. Even the two airs, sometimes one make more wax than the other. So there's not a fixed ratio. And so people, up to today, somebody complained, but doc, how is that my ear not making wax? But you should be lucky. But so some people don't. Not everybody does.
And the Q-tip, the use of Q-tip make you produce more wax. So the more you irritate the area, the more wax you produce. So we encourage people not to use it as much as possible.
So that is why we if you have to set up a ground rule, you say just don't put that in your ear. But of course, you have to be judicious about it. If you have to clean something, say sometimes the air is wet and you have to dry it out, then you use the cotton bud, but it does more harm than good. So wax can cause a blockage, foreign body can cause a blockage, and there is this thing with adenoids and middle ear issues, and that's another big story whereby the middle ear is not working properly, accumulate fluid and cause hearing loss. But hearing loss in that way is a little more peculiar in the sense that if your middle ear has fluid in it, it's not only that you don't hear properly, also loud noise becomes uncomfortable. So they have loud noise intolerance, and they can have infection in there with pain and the usual thing, and hearing loss and pain. So all these can cause conductive hearing loss.
And this type of loss is treatable. That's the good thing about it, that this type of loss is treatable.
If I want to talk, I will talk about some other causes of hearing loss, especially in babies and young infants. And we know that babies, even newborns, their auditory system is developed already, though not mature, but the physical hair is fully mature at birth. In fact, while in utero, between the 5th and the 7th month of pregnancy, babies start to pick up sound in utero to the sound of the mother's heartbeat and all of that. So when they are born, they have developed to some extent. But there are some things that can happen while in utero or at the time of their born or in the first few months of life that can lead to hearing loss. If a mother picks up infection, we call it the congenital infections like toxoplasmosis, rubella. In fact, I want to stress on rubella and cytomegalovirus. All of that can cause. The mother is the one who has the infection, but the baby growing inside can develop hearing loss, which is very, very important. And when the babies are born, they can have, apart from the common ones that we have mentioned, they can have infections like they have encephalitis, some serious viral infection, chickenpox, measles itself, mumps, and then meningitis. Thank God that many of these infections are not common. Many mothers have not seen them. In fact, when I was thinking, I said I'll ask my colleagues in the hospital when was the last time they meet a child, see a child with meningitis. So it's not as common as it was before. But when it happens in a baby, in a child, can lead to hearing loss.
And meningitis, when I was in Scotland studying, I belong to in a hospital where they do cochlear implants, and most of the children who required cochlear implants had meningitis. It damages the nerve, so that's a central neural hearing loss. Severe damage to the nerve. So meningitis should not be treated lightly at all. At all.
Thank God for prevention. When we're talking about prevention, we talk about how to prevent it, but I don't want to jump the gun. Now we are still talking about things, causes of hearing loss in children.
So this would be the congenital one, more likely, especially the infective one, more likely to be neural nerve deafness. And not so the conductive deafness, because the sound cannot pass through, Usually it is because of a problem in the air canal or the middle ear.
Yeah.
But once you get beyond that,
Yeah.
it is going to be
So
nerve
where
deafness.
will you group things like otitis media, infection in the middle ear?
Well,
Possible,
yeah, that would be
conductive.
conductive hearing loss. This will be conductive.
However, if it's
Yeah, because
Yes.
the sound is not passing through, and especially if you have fluid in the air, the sound is not loud enough, and all of a sudden it's too loud.
Yeah.
Because in other words, your threshold for comfort has been narrowed down, and that's why the children complain. Oh, the loud noise, air is hurting them, and they cover their ears. So because the way the sound is transmitted, it causes a problem. Now we have a lot of children who go to school and have this headphone, and we really have not developed a policy on that, and it is causing a lot of problem, be it temporary or permanent hearing loss. It is something that the statistics will show later on, but I am not aware of much regulation being set up for that. So it just happened.
Yeah, actually, it's very, very. It's something that is giving me concern because when you moving out in town, on the streets, you see the young children, I mean, school age, teenagers. Everybody have their earphone, In the bus, both ears are clogged with earphones, and only God knows the volume of the sound they are listening to. So it's really something that
You remember
the whole community and the school should be aware of that. That's it.
But in
It's
what
going to be
way
a common cause
Yeah.
of hearing loss in children now if we are not careful.
how you feel we can address that? To have an idea of how much damage is being done by children who are older, like post-primary, who are older, they are still at school, and they walk in the school yard, both ears having have the buds in the air, and they're going around. We don't know how much noise they're exposed to.
Perhaps we can conduct a survey, a survey, because what I have noticed in taking the history of those of children, youngsters, adults, and elderly, one common thing I have noticed is that because we ask them what device they use in the ears and so on, most of those using devices in the ears would complain of tinnitus. Tinnitus, dizziness, ringing in the ears, and dizziness. Yes, some of them. So that was something that's why I decided to put it on the caption, on the form to capture, because
these two.
At the end of the day, if we can conduct a study because as we know, sometimes tinnitus can appear as a sign, one of the signs of hearing loss. So I was thinking of that, and I'm saying to myself, it would have been really nice to have a small research and find out whether or not these gadgets are really causing sensory neural loss or the nerve type hearing loss, as we spoke about.
But we have to find a way to measure the level of sound that they are listening to with that, and that will vary from individual to individual.
So
It will vary.
the way I thought about it is, if some of you can get a sound monitoring detector, or some of the cell phones can have an app that tells you how loud the sound is.
Yes.
So all you have to do is to get their permission as they are, without changing the loudness. Just rest the pod on the phone and see how loud it is, because the phone mic is just as close to the air.
Yeah.
So I think that's one way of doing it, whereby you carry out your research, you have your document, and you ask them whether you can check the loudness. You don't have to take their name, maybe the age, if you want any demographics on them, and just ask them, just rest the bud on the device, and it will tell you how loud you are. Because many of these, all the cell phones have the apps where you can look at the loudness of the sound, how many decibels. That's all over.
Yeah.
So that's one thing. But any of these research would have need to have some ethical guidelines and ethical approval. And usually the medical council has an ethical section where the research can be verified. Because what they don't want is to be intrusive on people, discomfort to people, and taking the information and use it for other reasons, among other things. Because they have research guidelines, etc. for that.
But I was thinking, though, in the interim, perhaps our role is really to address the effects of loud
noise.
Yes,
Yeah.
so teaching them safe listening practices
Mhm.
and so on, going about doing that, so that when we do the research, you can tell them that you know that there are ways we can listen to music which will not damage our hearing. So to bring that
Yeah.
to do some healthy practices.
Yeah. And that will bring us to let them know that hearing loss can be in degrees, right?
Mhm.
You can have the mild degree, you can have moderate, and you can have severe, and what do you call the profound hearing loss, where
Yeah.
the person is not hearing at all. And so, if anybody doesn't go for screening, I'm sure many people will have a mild form of hearing loss that they wouldn't know. They wouldn't know. And so, research will help to know that, to know where you are, screening to know where you are, so you can prevent progressing to moderate and to severe hearing loss, where it is preventable.
Because that is the thing with hearing loss. Hearing loss is insidious, it's silent.
Mhm.
It's not always noticeable, but it can progress to the having profound loss and deafness.
And there are some misconceptions. For example, I have heard one particular young boy say, "Man, I don't. If you have to put the thing loud. Your ears must be hardened to get accustomed to it, as if your ear too soft." But what is happening is that if you have to put the music, the music or whatever louder, it's damaging the ear more. So you have to have it louder for you to hear.
Yeah.
So it's not you getting accustomed to it; it's damaging your ear.
Yeah.
And
I'm
that's
sure that person most likely has some degree of hearing loss.
Mm.
That's why he thinks it must be loud for me to hear well.
But maybe I can interject here to say that the Ministry of Health, Wellness and Nutrition has in place hearing screening throughout the lifespan. So we have the child health services that is free at all the various wellness centers.
Let me even tell you, before you start that, you could start at the newborn. At the newborn. Even though
we have free antenatal.
Yeah, at the newborn level, when the babies are born, in ideal, every newborn should be screened. But we can say that we may not be doing that, but we screen at-risk infants. Like when we have premature babies that have neonatal jaundice, or babies that are very sick and pass through the neonatal intensive care unit. When we discharge them, we send them to you to go and for screening. So before you get to the stages of development where you're going, so you can continue. I just want to let them know, even at newborn in the nursery, we start looking for them and we pick them.
They're
up.
sent to me, but however, we do not have the equipment to test the children, the neonates. And so, at toddler age. So what we do is that we send them to the nose and throat specialist, Dr. Surage and Dr. Sixtus Gabriel, who have the equipment, autoacoustic emission, which they would conduct on these children. However, from the toddlers, we would notwithstanding, we do have screening throughout in the child health service, where they are tested from 6 weeks. They do a certain degree of hearing test. We also do it again at 8 months, 18 months, 2 years,
1 year,
3
2
years,
years, 3
5
years.
years.
Yeah.
So if any time along that continuum, they do not meet their milestones, whether it be just in hearing itself or their speech and language, they are referred to me. Similarly, like you said, if there was any birth trauma and so on, they referred to the hearing clinic, and that is done. And we also conduct school screening, where we go to the schools, in some cases, or the schools come over to us to be tested. So all our children, at least, so far, St. Lucia has incorporated hearing health in their school program.
Okay.
And that is one of the World Hearing.
And I think that's what I was reading on the WHO, that if you incorporate the hearing health into an existing platform, then you are more likely to get it accepted. Yeah.
Yes.
Yeah. And so basically, can you just go over for me at what age you screen? You said at birth, and when you can pick all, at least those who are at risk are marked out, so you make sure that they get an evaluation.
Yeah. So at birth,
yeah.
the newborn, those who are at risk, not every newborn. So those who are at risk, depending on the history, the antenatal history, the delivery, and what happened in the first few weeks, the neonatal period. So we pick them up and we refer them from screening. And like Nurse Sydney said, eventually they land on your side so that you can do the specifics. And then after that, we have the normal developmental surveillance, not just for hearing, but for the total aspect. And hearing is part
neurological
of it.
and everything.
Right. And so we do start that at 6 weeks. And part of the the hearing assessment that will be done, we want to know, does the child startle with noise? A 6-week-old baby, we expect that when you make a loud noise, the child will startle.
Yeah.
Right. Okay. And all through the period, the nurses continue to see them. Okay. But the developmental surveillance, after 6 weeks, we do, this nurse still see them 1 month, 2 months, but we do a complete assessment again at 8 months.
8 months,
right?
Yeah.
So by that 8 months, you expect the child to be even before that, to be making noises, calls, turn to name, turn to sound. And so those are the questions that the nurses are asking mothers. We call it the well baby clinic or child health care. The child is not sick, you're just checking the normal development. And so those questions will allow the nurse to know, this child at 8 months, I expect you to turn to your name. I expect you to be saying mama, dada, making noises.
Yeah.
Now, because if you're not hearing, you will not make any. You will not make any sound.
And even when you listen to those that cannot hear properly, the sound they make don't make sense.
You're right.
Yeah. They babble some things, and you'd have expect them to say mama, dada at a certain age. Then these are called the developmental milestones.
Yes.
But even when they speak, you can see sometimes they have the ability to make words, but they do not know what to say because they're not hearing it.
So
and that's serious.
After 8 months, we do that 18 months, we do it at 3 years and 5 years. And since I want to also put in here that sometimes a child could start developing normally, the milestones, like you said, the first month is achieving it, but somewhere along the line you find that is not progressing. Especially in the speech and language, like we have said that hearing is very, very important in development of speech, language, and even cognition. So we have all those questions at different stages of life that will help the nurse to say, something is wrong with this child, and I need to do something. I need to refer. I need to screen. I need to take more action.
And Dr. Surage, sorry, we have to take a little break. We'll get back in just a moment.
All right.
Okay, this is Doctor in the House live on REV-UP St. Lucia 95.9 FM. And the program is brought to you with the compliments of La Place Salazon, Channel Cooperative Credit Union, and Tapio Hospital.
Tapio Hospital Radiology Department offers 24-hour service. We provide you with X-ray, CT scans, and ultrasound imaging using the most modern equipment that produces the best images for your medical attention. Call the Radiology Unit at 459-2201. Tapio Hospital, where the patient safety comes first.
In the heart of St. Lucia, where mountains meet the sea, there's a story of resilience, community, and a promise kept for over 50 years. Jana Credit Union has been a pillar of support and a friend. Together, we've weathered storms and celebrated triumphs, from sponsoring local events to supporting education. Our motto, together we can move mountains, isn't just words. It's a commitment to unity, progress, and shared success. Feel the pride, the belonging, and the warmth of a financial partner that cares. Join us and be part of something extraordinary.
It's delicious.
La Plaza Salazar is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Plaza Salazar, of course. La Plaza Salazar, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
Welcome back. This is Doctor in the House live on REV-UP St. Lucia 95.9 FM, hosted by Dr. Leonard Surage. Dr. Surage, it's back to you.
Thank you again, Andre, and listeners, thank you for staying on and listening and following what we're doing. At this point, we can open the lines and ask you if you want to make a contribution. Either you want to add to what we are saying or correct us if you think we're making errors. And the number is on the fixed line, 572-9710, or WhatsApp. You can shoot us a text, 287-0971. I would welcome your contribution. So I have with me, as we were saying earlier on, I have with me two ladies, Dr. Agonlusi, who is a community pediatrician, and Nurse Sydney, who is a nurse practitioner but heavily involved in running the Herring Center in Entrepot. So, ladies, let's continue where we started off. And we were talking about hearing loss and preventable hearing loss and early screening, etc. Because screening is extremely important. A while ago, I was going to butt in just to explain what cognition is. Because when there is hearing loss in a child, it's not only about not being able to speak, it's also about the frustration of trying to express yourself. And that leads to behavioral issues. Because you cannot hear, you cannot develop language, and you mutter things that don't make sense. Thirdly, because you cannot analyze concepts, intellectually you become deficient. Because communication is such that you think on what you hear, you make predictions on the things that you are analyzing, but you must be able to hear. The absence of hearing has profound implication on all facets of your life. And it is sad to know that 60%, as the records say, are preventable. And 90%, 80%, I think, are in children. And when I listen to all the checks and balances we have, I wonder how a child can escape without we knowing that they cannot hear. Mm-hmm. Is it because parents not bringing the children forward, shielding them, or we say we are doing it, but in reality we don't reach everybody? Mm-hmm. So there are issues that we have to deal with, because the child is a responsibility of the state, and therefore if we want the quality of citizens to lead into the next century, we need to begin to plan it now and make sure that they have the best environment in which to learn.
Thank you, Dr. Surage. You talk about how a child could, escape all of those checks and balances that have been put in place.
Yeah.
And I think it starts from the antenatal period. We mentioned some infections that the mother can get, right?
Yeah.
So good antenatal care, which is available,
right.
but whatever and free. Thank you, and free and free in St. Lucia. No mother is paying for antenatal care. It's free and it's accessible in all the health centers. So we need to access that. Because while in pregnancy, the nurse can detect if you're having signs of viral infection and can quickly refer for proper care. The other thing I want to mention also, which is very, very high in my heart, is immunization. And
immunization.
I want to stress it because there is this trend that there are so many mothers now that want to claim their rights. And well, nobody can force them. The pediatrician cannot force, the government, the ministry, the CMO cannot force, the PNO cannot force. I don't want my child to have immunization. I don't want. And we mentioned many of these infections that are vaccine preventable. We mentioned rubella. Rubella in a young child or in a mother who is pregnant can cause hearing loss.
So what is rubella?
Rubella is a viral infection, right? Usually when it happens, it's a mild infection. You may not even know you have it.
Okay.
You just have a mild fever and a little rash. Sometimes the rash just appears for a few days and disappears, and you get well. But if it's happened in a girl who is pregnant, then that baby is at risk.
Okay.
And the vaccine is there that we give to children at 1 year and 18 months. So if you don't get it, well, that means a child like that later in life, if he's exposed to rubella, can get it. And who knows, the devil on the side of that person, you have that infection, a mild infection when you are pregnant.
But sorry,
you have a call.
Oh.
Whenever you're ready.
Hello, good evening. Hello.
Good evening, Doc. Good evening, Andre.
Good evening, sir.
Yeah, good evening, the two ladies.
Good evening.
Okay, thanks for accepting my call.
All right.
Welcome.
Yeah, to Dr. Surage and the two ladies. Dr. Surage, when a lady is pregnant, what can she do wrong that can cause this child to be born with hearing problem? Yes, I listen on the radio, but let me just add another piece. When this lady is pregnant, can excess drinking, or a little lack of exercise, I don't mean to lift weight, but a little walking, by excess smoking, excess drinking, can this lead to this child being born with hearing problem? I listen on the radio.
You asked two questions. When a lady is pregnant, what can cause the child to have hearing loss? And secondly, does smoking and alcohol contribute to hearing loss when in a young child? I would say that the smoking and alcohol, there is some kind of relationship, but not necessarily to air alone. It is the general health of the child that suffers, of the mother that suffers. And they say if you are taking alcohol, it reduces some of the nutrients you absorb, and secondly, it prevents you from taking care of your health the way you should. So one thing leads to another, and it can cause, not that it have to cause, but it can cause some nutritional deficiency, etc. And so from that point of view, I would say stay off these things if you are pregnant. alcohol and cigarettes. That's for good measure. Now you're saying what else can cause people, pregnant people, to have a problem with their children have a problem with hearing, and I think Dr. Ogunlusi began to mention a few of those viral illnesses, and we mentioned many of them, mumps, rubella, measles, all these things can cause that. And also meningitis, which is an inflammation of the covering of the brain. The brain has a covering called the meninges, and it gets infected. And the infection there is quite difficult to access because of it's in the skull, and you have to have high antibiotics that can penetrate the blood-brain barrier to get to it. So many things can cause infection. Of course, viruses as well as bacterial stuff. Any other?
Yeah, if I may add one, the first thing I want to say is that some of the times a mother will have a baby with hearing loss, and we don't know why it happened, so we may not be able to explain. There are some causes that we call the genetic causes, right? We know that all of us, we are made up of genes, so there could be some genetic causes that is not preventable, and some children that are born with some syndromes, which is also genetic, like the common ones everybody will know is Down syndrome. They may come with that, and then you mentioned about the immunization, infection in mothers, in a pregnant mother. So if a pregnant mother has this viral infection, the baby can be born with hearing loss. So we need to know that. Dr. Surage answered the part of the alcohol very well. Alcohol is not just for hearing, but the total development of the child. There's what we call the fetal alcohol syndrome or fetal alcohol disease. As a child is born, it affects the whole development, the behavior, the neurology development, cognitive development, and everything in total. So alcohol is very, very bad. Very, very, very bad. A pregnant woman should not even go near alcohol. And so also smoking. So that is it that can cause it. And he mentioned the other things. When that child is born, before we even know that, start detecting if the child has some serious infections, meningitis, encephalitis, can, as a child get into 6 months, it can have hearing loss. And the good thing is that we are not seeing this infection again because vaccines prevent them. There is one vaccine that we give, the pentavalent vaccine. It contains diphtheria, pertussis, tetanus, and Haemophilus influenza. That Haemophilus is deadly if in children before the era of vaccines, because it causes meningitis, one of the bacteria that causes meningitis. But we don't see it again because almost every child receive it. And I was saying, since we are on preventive part, that we have to be careful when we start seeing mothers who says, well, I don't know what is measles, I don't know that, I don't think my child needs it. Yeah, your child may not get the infection, but we're reducing what we call the herd immunity. And the more of such children we have in the community, then the higher the chances that those bacteria, those viruses will start coming back again and again.
Okay, it's not only about your child is not vaccinated and can get rubella or a disease, but the fact that they can spread it to other people. So it's not only about you, it's about the community.
About the community.
So you cannot be just selfish and say, I'm not interested, I'm not in it, so count me out. Because whatever happened to you will affect other people.
And if I may say too, I am very happy the gentleman mentioned the pregnant woman. In St. Lucia, sometimes, though the service is free, we find some people are reluctant to come to the health center. So most times they come when they are near delivery so that they can get, their peoples to go to the hospital. But we urge them to come as soon, as early as possible when they have identified that they have missed a period and they may be pregnant. Because the nutrition of the mother is very, very important, especially in pregnancy. So a mother who's anemic, a mother who's not eating well, will produce a baby who's not well. And that is why we encourage. And that's why premature baby and all of these things put the baby at risk of not only hearing problems, learning difficulties, and growth and development. So it is very, very important that when a mother is pregnant, that she ensures she comes to the facility to receive the care as soon as possible. Like you said, Doc, she will receive the lab investigation forms, she will receive counseling on nutrition and how to care for herself and her baby in the womb.
Yeah.
So it's very, very important.
Yeah, and the vaccine, I think we should have a separate session on vaccine.
I believe so.
And I think I tried to organize that once, and I was asked to go to, there's one particular person at the ministry, but it never really worked out. Maybe they were not available at that time.
I believe so. I'm available. Because you know why I said that? Almost every other week I will encounter a child, no vaccine. And you see both the mother and the father, why don't you? I don't want. Did you receive it? Yes. Did anything happen to you? No. Both parents received when they were children and nothing. Some they will tell you, oh, my first two children had vaccine, but this one I want to be natural. And so no vaccine. Yes, of course, when I see those children, they are growing well, nothing, they don't have the infection. But like we said, we are reducing the coverage in the community, which we call the herd immunity. For us to keep a virus at bay, about 95% of children or more in the community need to be vaccinated. That means if the virus lands in that community, cannot find a place to stay.
Right.
Yeah. But when that percentage start reducing, we get 85, 75. We still have a lot. 75% out of the community, still a lot. But that means that if the virus lands, there is room, he can stay.
Okay. So
and once he can stay, then he can move around and move around.
Right. So let me put that differently.
Yeah.
And you can help me with it. So if you have 100 people and 75 are vaccinated, 25 is not. I come with a disease like rubella, whatever, whichever one. I am likely to spread it to the 25 that are not not protected. And so therefore, that virus will spread and cause problem.
Yeah.
With the herd immunity, what I'm hearing you saying is that if you have like 95% or 95 out of the 100 who are immunized and somebody come with the disease, it is hard to spread it because 95 are protected.
Yeah.
So the chance of you have to identify the 5 that are not protected for the virus to have a chance. So I want to emphasize that.
You are very, very right. In fact, that 95 is as if they are a covering to that 5.
That is
so
right.
we want to maintain that 95 and above, even if we can get to 100%, very good. And that is how we can talk of eradication eventually. Now, if our immunization rate is high, then we can talk of eradication because we can say for the past few years, nobody has had this infection. We know we kept it at bay.
So if you have 95, 98% coverage vaccinated, so somebody comes in with the disease, there's no way to spread, and the disease itself don't last forever. It will die.
It will die.
It has to be passed on for it to survive.
Yeah.
You have another call.
Hello?
Yeah, good evening, Doc. Is it again?
Yeah.
Good evening.
I hope I was able to answer your question, but go ahead.
I got some satisfaction there. Yeah, thanks for accepting my call.
Welcome.
Doc, when a child is born, at what time or days can you say this child has a hearing problem?
Almost immediately.
And how do you detect that? Almost immediately.
Yeah, because there are equipment now that when the child is born, say the day after or whatever, you can know if the child respond to sound. Because you may not do a test to see if they can hear well, but you can know if they are responding to sound. And you can add on to that one.
Yeah. Yeah, so apart from the equipment, like you said, there are some things that we expect to see on a newborn baby up to 3 months. I mean, like we said it earlier, I'm not sure whether the person who is asking question heard us then, that a baby who is born startled to noise, right? So when you make a loud noise, even a newborn between 0 and 3 months, they startled.
Yeah.
So that means that child can hear the noise. So if you have a child that you make whatever noise you're making, the child is not startled. A baby when he's crying is soothed by the mother's voice. A 1-month-old baby child, he wakes up and is crying. Just mommy say, "Hey, daddy, darling, cuckoo." The baby will just calm down because the baby he's used to that voice, so that baby is hearing. Right, and baby can be awakened too with a loud noise. So those are some of the sounds.
Say a door bangs, they will startle.
Yes, and as the baby is growing older, over 3 months, there are so many things. The baby start making noises, like we said, cooing, right? So those are indications that this baby is hearing. By the time you have a baby who is 6 months old, and you make noise, by that time you'll be calling the same name. He knows this is my name, and you call, the baby doesn't turn to you, then you know there's problem.
And by
issues,
detecting
right?
that problem,
so when we pick that one, then it's when we send to our ENT specialist, Dr. Surage, to do the special test for us to determine, confirm.
Good night.
Okay, you were asking?
He hung up.
Oh, he hung up. Yeah. Okay. Yeah. So I think that the explanation is satisfactory. That you from both onwards, there must be a way of finding out if the child is not hearing. And of course, if they hear noise, they may turn to one side and
So like
direction of noise.
Noisy toys.
Yep.
Toys.
Yeah.
Was that?
No, I
He
said
said
noisy
even to
toys.
their toys, right?
Yeah.
To the rattling
So the
of the
parents
toys.
can try, on either side, just rattle, use all those noisy toys, and they would turn to the sound.
Yeah, and so we were talking about the different vaccine that we have, and we said that at some point we'll have to come back and talk about the vaccine in a much more
elaborate way.
Yeah, but I also feel that what we are overlooking, and we've said it in different programs, that out there in the open has a lot of information and a lot of misinformation. So by us not understanding what makes people make decisions and just giving information, we may not be reaching many people, because there is internet, there is a lot of false information. As Dr. rightly pointed out, some people want the natural because they believe the natural stuff is safe. But we have evolved from the natural stuff to protect ourselves so that we can live longer, we can live a higher quality of life. And so you have many arguments against vaccine, against many things, that is because of the abundance of information that permeates. Some of the information are totally incorrect, but these are the challenges we as medical people have in terms of being able to practice our skill.
And Doc, if I may say, another great challenge is that the stigma associated with hearing loss. So you find that you have identified a child who had a loss or speech delay, and you have referred the child for further investigations. Sometimes the parents delay on that. And when you see them, it's almost beyond correction. You understand, helping them. So that is another thing that we would really want addressed, that when your child has been identified to not meet their peers in the developmental screening it is important that when you are referred, that you go to the facilities for help for the child, because we want to again stress early detection, early management. So it's like speech therapy and so on. And while it's true, we know that the Child Guidance and Development Center is almost inundated with the amount of clients they see, but at least you would get some priority to get some speech therapy. So we are urging them, parents, whenever your child is referred for hearing tests and other investigations, please do not delay. Bring them to the facility. Try to get an appointment so that they can be seen and managed.
So you find many of them come too late?
When we find them,
They're delayed.
They're delayed.
When it's picked up, they don't take it serious for whatever reason. But the next time you see him,
because sometimes you see they were referred from the early stages, 2-3 years, they never came.
But could it be that they are frightened of being referred to special education?
That's most of them
Sometimes.
express that.
Sometimes, yeah. But if a child needs that, it's better we start that early. I think you should tell the public about the screening that you do at the different centers where they can come for screening. Do we mention you keep mentioning entry poll?
Well, I was going to tell them actually the target audience for this year and where we conduct the hearing.
We have 2 minutes to finish.
Okay, well. The Ministry of Health, Wellness and Nutrition offers the free service hearing and audiological services at Entrepot Wellness Center, which is at Entrepot. The number to make your appointment would be 468-7935, 468-7936, 468-7937. Any of these numbers, call and book an appointment. And in the south, at Vifort Wellness Center, at 468-7985 or 468-7995. These services, again, they are free. And as we said, if your child is referred from the neonatal unit, you can consult any of the ear, nose, and throat specialists. They have the special equipment that we currently do not have at the health centers. And children from toddler age, we have the pediatric audiometer that we screen them with.
Okay.
And all the services are free.
Services are free.
And, I forgot to mention, at Entrepot we are available on Tuesdays and Thursdays, and in the south at Vifort Health Center, it's on Mondays and on Wednesdays, 8 to 4:30 p.m.
Can anybody walk in, or they need to book appointments?
Well, due to the number of clients accessing the service now, we have an appointment system. However, if they have concerns with hearing aid and hearing, those persons who were issued hearing aids, they can come into the clinic on any of the days.
Okay. Well, I think we have to wrap up this session as we're passing beyond 7 o'clock. Thank you very much, and hope that we can continue that discussion at some point, and especially the one with the immunization. You wanted to say something?
I was just saying, just remember that World Hearing Day will be on March 3rd, 2026.
Yeah.
And they can look out for the
flyers, for the adverts,
the social media, and the different messages that will be sent on the various
ladies, thank you very much for being here. And
thank you.
I wish you all very success in your endeavor.
Thank you.
Right.
Thank you.
Thank you, Dr. Surage, and thank you to your guests.
Thank you.
You've been listening to and viewing Doctor in the House live on REV-UP St. Lucia. You can check out Dr. Surage every Tuesday from 6 p.m. to 7 p.m. right here on REV-UP St. Lucia. And Doctor in the House brought to you with the compliments of La Place Salaison, Jeune Cooperative Credit Union, and Tapion Hospital.
At Tapio Hospital, we operate a 24-hour emergency service for all your urgent healthcare needs. Our qualified medical specialist will be on hand to ensure that you receive the best of care. Call us at 459-2617. Tapio Hospital, where the patient safety comes first.
In the heart of St. Lucia, where mountains meet the sea, there's a story of resilience, community, and a promise kept for over 50 years. Jana Credit Union has been a pillar of support and a friend. Together, we've weathered storms and celebrated triumphs, from sponsoring local events to supporting education. Our motto, "Together, we can move mountains," isn't just words. It's a commitment to unity, progress, and shared success. Feel the pride, the belonging, and the warmth of a financial partner that cares. Join us and be part of something extraordinary.
It's delicious.
La Plaza Salazar is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Plaza Salazar, of course. La Plaza Salazar, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
Join Dr. Leonard Surage on REV-UP St. Lucia Tuesdays from 6 p.m. to 7 p.m. for Doctor in the House. This 1 hour discussion